Greetings, this is Dr. Karthic Natarajan. I'm an interventional spine and pain physician working in the Synapse Pain and Spine Clinic in Chennai. We are located in Besant Nagar, Adayar in Chennai. Today, I'm going to be talking about elbow pain caused by a common condition called tennis elbow. Now, tennis elbow, technically as a doctor, we call it as lateral epicondylitis. Now, this happens when we do some actions which can strain the outside of the elbow. So, this could include actions where we are lifting something heavy like some gardening work, sometimes we are pulling something. So, usually the tennis elbow pain is on the outside of the elbow here. If the pain is more on the inside of the elbow, which we call as medial epicondylitis, this is called golfer's elbow. So, the tennis elbow pain is outside, the golfer's elbow pain is inside. This can occur on either shoulder. Now, this is usually a disease that we see which is brought about by lifestyle. This could be you lifting something heavy with using your elbow, or something is pulling your elbow. This could even mean pouring some water with your mug. So, this can happen. So, this group of patients come with pain, some redness and some swelling in the outside of the elbow. So, most of the time the diagnosis of tennis elbow or lateral epicondylitis is done clinically. So, when the doctor touches the lateral epicondyle, which is the bone, which is the lower and outer part of this bone called humerus, the patients may be having severe pain there. So, tennis elbow is a fairly simple and non-dangerous condition to treat. So, this is a pure musculoskeletal condition. So, how we treat it is, first we treat it conservatively. So, conservative treatment of tennis elbow includes icing. So, ice fermentation is very useful for joint pain and for inflammatory conditions. We encourage patients to apply ice for a duration of 10 minutes, 2 or 3 times a day in the place where they have joint pain, in this case the outer aspect of the elbow. Second is, we ask them to avoid that activity which may strain the elbow, which could be lifting some mug, which could be riding a two-wheeler, which could be lifting something heavy. So, we ask you to give rest to the elbow. Next is, along with the rest and the icing, the other thing that you can do is, there are some basic elbow braces. So, this can be available in any pharmacy. So, these braces are specifically called tennis elbow braces. They come with a strap and they are stuck by Velcro. So, you have to wear the tennis elbow brace just below the elbow grease. So, the conservative treatment includes rest, liberal icing, tennis elbow brace. Along with this, we will give you anti-inflammatory medication for a short duration, which could be anything between 5 days to 10 days. So, majority of patients with conservative treatment tend to become better. Now, tennis elbows can sometimes take a period of time, which could be anything between 4 to 6 weeks to settle down, because the basic pathology is a tendonitis. So, tendonitis of the tendon that attaches to the lateral or the outer aspect of the elbow, that's only tennis elbow. So, for any inflammatory condition to settle by itself with conservative treatment can take about 4 to 6 weeks. Now, there are a group of patients who have very severe pain, or there are a group of patients who, in spite of trying conservative treatment, which includes anti-inflammatory, rest, tennis elbow brace, continue to have pain. So, if your pain is very severe or if your pain is long lasting, there is a scope for doing something which is called a tennis elbow injection. Now, tennis elbow injection, before deciding, we always try conservative treatment. Only in patients who have failed conservative treatment, we think about tennis elbow injections. Now, there are 2 types of injections for lateral epicondylitis or tennis elbow. The basic one is a cortisone injection. So how we do this is, we bring the patients to the procedure room, we clean, and then we put an ultrasound probe on the outer aspect of the elbow. In the ultrasound probe, we'll be able to see the bone and the tendon attaching here. We give good local anesthesia, so the place is numbed. So under ultrasound guidance, under local anesthesia, we inject a medicine which includes a little bit of cortisone around the tendon and around the lateral epicondyle, which is the bone. Now, majority of these patients may settle down with the cortisone shot. Now, there are a group of patients who have refractory tennis elbow pain. There are also a group of people who are sportsmen, right? Remember, the great Sachin Tendulkar had tennis elbow. So, there are elite sportsmen, people who want to go back to action very fast, who can't wait for the cortisone shot, or there are a group of patients who cortisone shots are not useful, patients with high sugars, patients with osteoporosis. They have to be careful with cortisone shots. So, probably a newer and better treatment for tennis elbow is this newer thing called platelet-rich plasma injection. So, platelet-rich plasma is called PRP injection. So, we find that the results are really amazing with these platelet-rich plasma injections. So, platelet-rich plasma, we take the plasma from the patient's own blood, we take the blood, we centrifuge it and process and take out about 2 to 3 ml of platelet-rich plasma, and we inject the platelet-rich plasma at the place the patient is having tennis elbow pain. So, we give good local anesthesia. Under ultrasound guidance, we inject platelet-rich plasma around the extensor tendon, which attaches to the lateral epicondyle. So, we identify the tendon. Under vision, we inject this platelet-rich plasma, and we find that with platelet-rich plasma, the results are better and the results are permanent for tennis elbow. So, to conclude, tennis elbow is a very basic, simple musculoskeletal condition. Conservative treatment is rest, icing, tennis elbow brace, and anti-inflammatory medication. If it is not coming around with this, the basic procedure that your doctor may advise you is a cortisone shot. In spite of it, if it is not coming around, or you want to get back to action very fast, or the pain is very severe, a better option would be a platelet-rich plasma injection, which is a PRP injection, which is done around the tendon under ultrasound guidance, under local anesthesia. It is a safe and effective way to treat tennis elbow. I hope that video was useful. Thank you.